You're not an island. You need friends. You need community. Half of the things that I have achieved right now, yes, I give glory to God for that. But you need friends and community. So, and you can find them in your class. You can find them in your religious spaces. I'm a Christian, so church. You need those help. So I know there's a loneliness epidemic when you come and you think you can integrate, but you can actually make friends because they make life so much easier. My friends helped me analyze my assessments before I even submitted it, and I did same for them as well. So have friends in your class and also outside.
Relocating doesn't come with a manual. You cross borders with dreams, skills, and ambition. But the real journey begins after you land. Winning Across Borders is the podcast where Africans in the diaspora share the real stories behind building careers abroad. From survivor jobs and career pivots, to breakthroughs, setbacks, and redefining success in unfamiliar systems. No filters, no shortcuts. Just honest conversations, practical lessons, and real blueprints. This is Winning Across Borders.
Hello guys, welcome to another episode of the Winning Across Borders pod. This is the podcast where we share rich stories of Africans navigating life, careers, and opportunities abroad. Today's episode is one I'm really excited about because we're diving into the intersection of public health, data, and system level impact, and what it actually takes to build a meaningful career in UK as an international professional. I'm joined by Brenda, a public health professional who's had experience supporting children and young people, particularly within SEND and mental health services, from background in medical, laboratory science, and transitioning into public health through a master's degree, and then working within the NHS. And if you understand the UK market, it's not easy for someone to get a job before they graduate. And that's the story of Brenda here. So today we're going to talk about what it really takes to break into public health roles in the UK, how she navigated job applications and stood out, and the realities of working with the NHS, and how she's intentionally positioned herself for data-driven roles in healthcare. So if you're a student, a recent graduate, or someone trying to pivot into public health, this episode is for you. So please help me welcome Brenda to the episode.
Hi, everyone.
Welcome. So to get started, the viewers would like to know more about you. Could you please just give us a brief intro about yourself?
Okay. Usually when someone wants to know more about me, it's always like, what exactly do you want to know? But I'll give a short intro. I hope it's short. In my opinion. So he already introduced me as Brenda, and he told you quite a lot about my background. So I did my undergrad in medical laboratory science in South Africa, actually. And so I moved from South Africa to the UK to study for my master's at the University of Chester. One thing I would like to say about myself is that I'm a go-getter and I'm very determined. I do not play about my intentions. When I want something, I'll get it. It's very important. I am an overachiever, I like to say. And so me pivoting into public health was a very high leap for me as well, because I didn't really think I wanted to do masters, if I'm being honest. I was very content with where I was as a medical laboratory scientist. But then my dad was the one who decided that I should challenge myself, which I did. And I did my public health, my master's in public health, and I knew I also wanted to get distinction. So another thing about me is that I did not just do my master's. I aimed for a distinction, which I got. Guys, you can do it.
Wow.
Anyone can. And I also was a very balanced student. I did not just study, I also had fun. Ask anyone in my class, my lecturers. My supervisor was also shocked to even realize that I used to travel a lot. Even while I was doing my dissertation, he could not believe that I could do all of that and still thrive. So I'm a well-balanced individual as well as a go-getter. And so that is a brief story about who Brenda is.
Thank you very much. That was really interesting. I'm sure people will be able to learn from that you can actually balance both worlds and still achieve great things. Yeah. So I'll take it back to the... Okay, great. Thank you. So I'll take you back to the very beginning. what really made you decide to have a bachelor's in medical laboratory science? Growing up, had you already had that imagination to be in the medical field? Was this something that you saw that pushed you into that line?
So I always wanted to be in the medical field. It was always a dream of mine. And to be honest, I wouldn't say I was a sick child, but my childhood, I spent most of it in the clinic. So my mom is a civil servant, and luckily for her, as a civil servant, we had the opportunity to go to the clinics with subsidy or for free for the government clinics because we didn't need to pay. So she was very lucky. And one thing I remember is I was always asking questions about what medication they were giving me or what the doctor was about to do. I went there recently meaning like 5 years ago, and they still remember me because
Wow.
I was the kid that was always asking questions, and they did not remember me because I obviously used to go there often, but it was because I always asked questions. I was just so intrigued about the medical field. Firstly, I wanted to be a doctor. But then I realized that I wasn't really one of those people that wanted to be in the front lines. So medical laboratory science was like the next best thing for me because there's less patient interaction and more of the background stuff, which I feel like worked for me. So I ended up getting there. So my family, my parents are also have a high academic background. Both my parents are PhD holders and they did study, and my dad did study in South Africa. So it was easy for me to move to South Africa because it was a familiar country that I also knew. So I ended up getting admission to Nelson Mandela University, and that's where I did my undergrad. So I've always loved the medical field. It's something that I've always been passionate about. Yeah.
Thank you very much. That's really interesting. And it's safe to say, coming from such background, you should always want to do more. So I was going to ask you, why did you decide to do a master's? But I can see the answer there already. You need to want to do more. But then so what I would ask next is, so why did you choose the UK to come to the master's, and why public health?
So why did I choose the UK? Firstly, I wanted to come to a country that I knew people and I had family in. So I have a lot of extended family in the UK. Also, my best friend moved to the UK from South Africa. So it was also like a good plan for me because I had people. I don't really have that much, family in Canada or US. So UK was a more sensible option for me at that time to move to. Also, at that time, the UK, don't want to say anything that will come back to bite me, but at that time, the UK seemed like a good choice.
Yeah.
So it was a no-brainer for me at that time. And public health, I've always looked at things from a more of a prevention aspect than, having to cure it. So if we can prevent it from happening, then the likelihood that people will be affected by the disease is less. And also, you're not just saving lives, but you're also saving money.
All right.
But
Yeah,
you're also saving the economy and also people from the impact of what can happen in the long term if that disease should spread. So, the several elements. So public health was a no-brainer for me, and also thinking about my background and my lifestyle. And also from a medical lab point of view, most people always think it should be doctors that should do public health because it just makes sense. But as a medical lab person as well, I'm dealing with all the bacteria. Like I have more understanding of the causative agents of the diseases, right? Also not just microbiology, but clinical chemistry. So the pathophysiology of why someone has a particular disease, I understand it. So it made sense that I would want to also deal with prevention, because also people getting sick or having trauma or long-term chronic illness from certain diseases or certain causative agents was also very annoying for me, because in my head, I'm like, this could have been avoided, right? So it made sense that I wanted to navigate into public health. So that's why I chose public health.
All right, thank you very much for that. My next question has sort of 3 parts. So the question is, you mentioned you had gotten a job before you graduated.
Yes.
Now, 3 questions. First is, how did that happen? Second is, what were some of the things you did while in school, and not only during academics, outside school, that helped you get that job? And the third thing is, a lot of people struggle after their masters in public health. What did you do differently?
Okay, so I'll try to remember these 3 questions in my head.
I can remind you. Yeah.
Please, I'll ask you to remind me. So the first question is, how did I get a job before I graduated? I think the last 2 questions would be part of this answer, because for me to tell you how I got the job before I graduated, I would need to also tell you what I did to get the job. And
yes, definitely.
What was the last question?
A lot of people struggle after their masters in public health. What did you do differently? So I think it's still the same thing.
Yeah. So I need to answer those 2 questions to tell you how I was able to get this before I graduated. So I'll start with what I did differently. I think that's essential. So I think the issue is a mindset issue. I want to start there, because there is this, when I first came and I told people that I was studying public health, the answers or the comments I got back was, oh, you're just going to end up doing care. So after that, you should look for something in care. It's just going to be easier. It's going to be hard for you to navigate the public health space. And I came with the mindset of, I'm going to win. So me personally, I didn't care about what people said, because at the end of the day, you're speaking from your own reality, but that does not have to be my reality. And I want to say that I appreciate everyone who has taken the care route. It is not an easy feat, because I've done it. So I know. But did I see myself doing that for a long time? Not really, because I knew that was not really my passion, and that's not what I wanted to do. And so it's a mindset issue, because a lot of people don't think far, especially coming to the country. It's more of, I just want to survive. I don't want to go back home. But then it's how do you want to survive? Because what I'm doing now is also surviving, right?
Yeah.
So it's also laziness, in my opinion, because you want to take the easy way out. But is it worth it? You choose. I decided to take the hard way, as a lot of people would. And the things that I did differently was change my mindset. I changed my mindset immediately I landed in this country, and I stuck to what I wanted to achieve. I didn't care about what any other person had to tell me. I really didn't. I only cared about what I wanted to achieve. That was one of the things that I did. 2, I had to understand what public health itself was, and what a career in public health would look like. So a lot of people think that for you to get a job in public health, it has to have public health in the name, which to me is not necessarily true. You need to understand what public health is to understand what a public health role would entail. So if your understanding of public health is lacking, then it's going to be very hard for you to navigate the public health workspace, because what I am doing now currently doesn't really have public health in it. But is it public health? Yes, because am I trying to prevent things from happening that could drastically change the population density, that could change mental health? Is it a prevention kind of role? Yes, it is. So if you understand public health and the aim and the values and the goals of public health, then you would understand how to navigate the public health workspace and how to look for a job, which is something that I took to heart. So I did not go to school to waste my parents' money or waste all the money that, to be honest, that I paid for to get to where I am. I actually paid attention. I knew that whatever information I got from my academics was what I was going to apply to whatever role that I was going to. And I understood that dearly. I didn't pay anyone. I know it's something people do, but I didn't pay anyone to do any of my assessments for me. in as much as I was having a good time, I also took time to also do my assessments myself because it was necessary to build the kind of person that I want to be right now in the future. So I understood that I needed to understand the concept of public health, considering that even though I did have a medical health background, I still needed to understand what I was going to do in the future, which is public health, because that's really what my passion was about. That's what I wanted to do. So I didn't take school for granted. I managed my time wisely. I understood I understood the importance of being a balanced student. So for me to also understand the culture of the UK, I needed to also be in it, experience it. So I actually took time to travel around the UK, observe how, British people, how Scottish people, how Welsh people and Irish people are. Like, I embedded myself in the culture because I knew that I also wanted to stay here for a long time. So I took my time to also explore the city or the island where I was going to eventually live in. So all this kind of prepared me for getting my job, in the sense that now that I had a concrete and overall understanding of the place, the job, the market, it was time to start applying for jobs. And so because I understood that, I knew where to also apply for jobs. I didn't just limit myself to track NHS. I also understood that councils also require, local councils also need public health practitioners and also need to prevent in their locality as well. They need help because from council to council, that is how you make a whole. What do you call that? Sorry, I'm looking for the word. It's not province. So if it's Merseyside, yeah, thank you. It's a borough. Yes, I think. So each council has to obviously do its own part to ensure the country as a whole is healthy. So they all need a public health practitioner. They all need someone who has the knowledge of prevention in whatever aspect it is. So I didn't limit myself to just one application site or job site. I went way over and beyond. And I was also open to relocating. I think a lot of people get comfortable with where they live, and then they feel like if they don't get a job where they are living, then it's like the end of the world. But if you truly want a job, you have to be open to moving around and relocating. And that's what also stems from traveling around to understand the country that you're in, because then you are no longer fearful of the unknown because you have experienced it. The question is, what else did I do? So what else is what I did? Now I'm going to start with that. I think I've already said a lot, which kind of intertwines. But I also volunteered. So even with my 20 hours part-time job that I was doing, and trust me, I really did 20 hours because I needed time to also do other things. And so I decided to volunteer. So I was volunteering for CSAS, which is Cheshire Sexual Abuse and Advice Service. It was a charity organization. And I was like I was an outreach volunteer. So first I just started out as a regular volunteer, and then they basically moved me up. So what I did for CSAS was I used to go to schools to teach children about sexual abuse. They also made me the lead. So I used to do like a lead workshop for older women who had experienced abuse. So CSAS and Tomorrow's Women in Cheshire used to work together. So we had a slot where we would basically take time to speak to older women who had probably been abused or, had trauma. So older women who kind of just also needed a space to just be. So I led those sessions, and I would just, do whatever they wanted to do. So we would plan ahead of the next week. And mind you, I lived in Liverpool. So every Wednesday I would travel to Cheshire to do that with my own money. They did pay for transport at the end of the month, but sometimes I didn't claim it, but you should. As a student and someone who's working part-time, you just don't throw that extra cash if it's necessary. So that's what I did that's another thing I did. So it was another element of showing my employers that I'm actually, I've taken initiative to want to know more and learn more. And I did learn more from that role, because that outreach and that understanding also fed back to how I got my job before I finished. And so also working as a support worker, I worked with children. So, and the role that I got for the NHS was a dynamic support key working role. So that role actually started in 2021, I think. It was a new role that the NHS had created to ensure that children with autism or learning disabilities aren't sectioned unnecessarily and left behind in a tier 4 institution. Tier 4 institution meaning like a psych hospital. So it came about because of the winter, I think it's Winterfell or Winterbourne scandal, and that's how the role came. So it was fairly new in Liverpool as well. So it was not an old role, but it wasn't a role that had come out in like 5 years. This was fairly new to Liverpool as well. And I looked at the role, so I was applying like as normal. And I looked at the role and I was like, I have all the experience. I work with children, I have a good understanding of autism. They were looking for someone who just understood what prevention meant, right? And I ticked all those boxes. And so what I did before I applied was, most people end up just applying for jobs. I took time to actually understand the role. I saw that the deadline was quite long. So I'll tell you how I navigate short deadlines when I find a job and longer deadlines. So this deadline was quite long. So usually how I pace myself is, if this is a job that I'm interested in, I try to understand what the role entails first before I even start my application. So what's this role asking from me? What experiences do I need? What is this role asking of me? Is this something that I have experience in? Can I do this? If it's yes, then I try to understand what the job entails outside what the context of the job description. I would go to the company's website. I would need to understand their values as well. It's very essential that you know your company values. So you need to know if that also aligns with your values and what you can offer them as well. I also need to understand the job outside of the job description. So I usually try to do short courses. This is a long timeline. I'm not talking about if this is short. So for that role specifically, it was NHS had a short course about dynamic support key working. And to be honest, even though the job description was long, it still felt quite vague because I still really didn't get it. Yes, I thought I could do the job, but I just felt like I didn't really understand the job description because it was very niche. Like, this is a niche role because it's specifically autism and learning disabilities. So I still was confused. So I did the course and it gave me more understanding because you needed to know legislature, you needed to know things from social care because it's an integrated working, multi-agency working. So you're not just working with health, you're working with social care, you're working with local authorities, you're working with charity organizations. So, and this was integrated care board, which that is one of their values, which is multi-agency working. So I needed to understand how to navigate that. So I now went to LinkedIn to find people who probably were doing this role. And for some reason, I went to Twitter. Guys, Twitter is a good tool. I promise you, and I actually met someone with that role. That is how I understood the role, because I met someone on Twitter who did that job. And I DM'd her. I was like, sorry, I have just gotten an interview, because after I did all that, then I applied for the role. And then I wanted to know more because I needed to prepare for the interview. I always prepare for an interview like every other person preparing is 3 times better than I am. So I have to be quadruple times better than they are. I must always be 1 step ahead of anyone in that interview. And so I must prepare like my life depends on it, because it kind of does. And that's the truth.
True.
So I went to Twitter and I found this person and she said, oh yeah, like, so what do I need to understand with the role? So I told her, I was like, I've done this and this and this, but I kind of need to know more. And so she explained the role to me. She explained what it would entail for me and what I could do to prepare more for the interview. And I took those things to heart. I took it to heart. I always prep. ChatGPT is also your friend, guys. Like, use it to prepare for your interviews. It is an amazing tool when you need it. AI is your friend, 2 points. 2 points. Don't abuse it. So I would tell ChatGPT the job description. And I would say, this is job description. This is what the role entails. How best? Give me like interview questions I could use to prep for this role. And then from those questions, when I don't understand something that it has asked me, or I feel like there are terminologies that I need to know that I'm not sure of, I'll prompt it to say, I need to know this and this and this. So for me to understand it, I need you to ask me questions regarding maybe social care legislature, or some legislation in health, or section 117. Like, give me questions on that. Not because that's probably what they will ask me, but because I need to understand what I'm getting myself into, so that whenever they ask me questions, I can actually answer like I know what I'm saying and not babble. So it gives my interview answers more depth, because you can now tell that I'm not just reading a summary. I actually did the work in my head to get to where I am. Exactly. So those are kind of the steps. So I started applying early. So another thing I did was I started applying way early. So when everyone was trying to wait till they finished, me, I was applying way ahead. So by the time I got this actual job, I had already gotten like 4 to 5 interviews. And honestly, I got the job for all of them. It's just that the wait time for me to start working full time was quite long, so they didn't accept me.
No.
And I feel like that was God's blessing in disguise, because I got a better job with better pay at the end. But it helped me because I was going to those interviews, I understood what I needed to do and how I needed to prepare. So it was more like a prep interview for the actual jobs that I wanted to. So my advice is start applying early and start getting into that interview space, so that you can prep yourself more. It gives you more understanding of the kind of questions that they would ask, and it gives you more confidence. So that's kind of what I did to ensure that I was able to get a role before I finished.
Thank you
Not
very
very
much.
long.
Yes, that was such an
But it was tricky.
expansive, yes, that's such an expansive response. And it's really covered most of the next questions I wanted to ask, but I'll just go through it and then pick from what you've said.
Okay.
So one of my next questions was going to ask was, for some people that just finished their bachelor's and came straight for master's, no experience, how would they go into the job market? But I would pick up from the fact you mentioned volunteering. That helps give you that level of experience. So I think that's something people should look into. Yes, also, there's another thing you mentioned about integrating, which ties along with that volunteering, also ties along with applying early. A lot of people come here to study and they are so laser focused on getting my 20 hours done, paying school fees, and then getting enough money for maybe graduate visa and all of that, and probably waiting till after school to actually start life, not knowing that life actually starts the moment you start your degree. And then you need to start making all those planning, which is something you did with volunteering, applying nearly, trying to move around and things like that. So I think that would answer the question of what mistakes are people making. So you need to start integrating early. You need to look into volunteering, especially if you don't have prior experience in that particular aspect. So yeah, that's why I said your response was very expansive. It's covered a lot of questions that I have. I'll just ask another thing. In your job application strategy, apart from multiple applications, understanding the job description, volunteering, and also an important part you mentioned was networking, because you went into LinkedIn, you went into Twitter to speak to people. That's actually networking. Was there any other thing that you felt like you did or people can also do?
Oh yeah, now I remember what I was going to say. Thank you. That was a good point. I went for every conference that my university offered to us. I was there and I networked. And it also gave me a good overview of what the job market was like. So when I studied in Chester, they did bring people from local councils to come and speak to us. And that is exactly how I knew that I should also be applying to local councils. They also brought people from the NHS as well to speak to us. But a lot of people did not catch that in terms of, where to apply, because if they are bringing people from certain spaces to come and talk to us, I think it should be an inclination that you can actually apply at your local councils as well. But then I also took time to go and speak to them after they were done speaking to us. So aside from people raising their hands to ask questions in class, I actually waited behind and I went to meet a few of them, and I was like, okay, so like if I'm looking for like jobs, what exactly am I looking for? And that was when one of them told me that I needed to actually understand what public health was all about to be able to understand what jobs I'm looking for. And so that was what prompted me as well to get a grip and to kind of have the understanding of what exactly I'm looking for in the job market. There were also conferences as well, and I went to those. Like, even if I was the busiest person in the world, I went and I networked. I used to be very, like, my friends would tell me that I'm actually quite vocal. Like, I try to, talk to everyone, but I'm also very reserved. And one of the mistakes that I told myself I was never going to make again, if I was to ever have the opportunity to study, was to be laser focused on my studies, because that's what I did in my undergrad, and it did not help me in any way. So I was like, I did not gain much from just only focusing on my books. I wasn't going to any of the conferences or any of the events, but my life literally did a 180 when I started to implement all of this, because if you don't know, I'm kind of a living example of what it means to be balanced. And I promise you, looking at most of the people who are successful, like I was looking at certain people who also finished from public health and are now doing well in the UK. And I've had the opportunity to even like be interview prepped by one of them. And it just made so much sense how being well balanced actually sets you up for something good, because it just shows that you can manage your time as well. Like, it gives you that opportunity to, change your mindset about certain things that you were so adamant about, especially coming from the background that we're coming from. And you're like, oh, you have to focus on your studies. Oh, you cannot, there's no time for play. But because of that play, it can actually put you where you need to be. Because now you're going for these conferences and you're actually talking to people and you're gaining more knowledge and you're gaining more contacts. Because if you ever need anything, I promise you, relationships are quite key. I know people are like, I don't like to network. It feels like I'm begging. You're not begging. That's two totally different things. Networking is not trying to be a fake, because a lot of us, especially in generation now, we have this concept of, I always see this on Twitter, like, oh, I just feel so shy. I can't network. It just feels like I'm degrading. Networking, if that's how networking feels to you, then you're obviously doing totally wrong, because you feel like you also have nothing to offer to the person you're talking to. And that says a lot, because you as an individual, you are a bank of knowledge as well. Culturally, your experience can also influence whoever it is, be it even if they're in a much higher position than you. You have that experience from the background of what is currently happening underground that they do not have at the moment, so they can also not see it. So you can give them that insight, and they can also give you that insight, because it can trickle down and it can trickle up. It can also, condensation and evaporation, both ways it works for the ecosystem. So if you look at it that way, you also have things to offer that person, and that person has things to offer you. And so that is networking, is literally clicking minds together. So if we change our mindset about what networking truly is, then maybe it would be much easier for us in our generation to do that. And so that's what I did. And turns out that I actually did have things to say and things to offer. And so if you believe that you have potential, networking should not be a situation of you begging for people who are probably in a higher position's approval. It's more of exchanging ideas and trying to get to know what your experience is and what their experience is, and how it best meets, both of your needs. in that sense. So yeah, I feel like that's another thing I did. And I feel like that's another thing people are not doing, because they're like, oh, I need to go for my shift. Oh, I need to do this. Oh, I need to do that. And I can understand that you need to go for your shifts, but I planned how my shifts work. So I chose days that were comfortable for me and days that I knew would not clash with anything that had to do with school relations or work relations or things that would empower me, because in regards less of that work is actually giving me money, I just knew that I did not want to be there forever. So obviously I needed time to do things that would push me to where I needed to be. So I ensured, I advocated for myself, guys. You can too. Do not be scared in your workplace. They can give you a shift time that does not work for you, and you have to advocate for yourself. And I did that because at the end of the day, yes, they are paying me, which is their job, because I'm working for them. So advocate for yourself. I always used to say, I cannot do this shift at this time. These are the times that I have given you, and you have employed me to do certain hours, which is in my contract. And I'm telling you that I can do those hours. But these are the times that I can do those hours, and these are the days. And they have no other choice but to accommodate you, because it is your right. So advocate for yourself. Don't say because you're a student, you're going to lose your job. Advocate for yourself. It is essential so that you can actually make the most of your time as a student. Because once you stop being a student, life gets real. I promise you. Being a student is actually one of the only times that you can do so much. Because now, when you do your 9 to 5, your weekend is to rest, catch up, and do other things. But currently, I also have a good work-life balance because of my current job. But that's aside the point. But for you to get to this point, you have to advocate for yourself as well. So another thing I did was to advocate for myself in my workplace.
Thank you very much. I've picked a lot from that, and I'm just going to go back on them. People don't realize that being a student, there's a lot of advantages you have. And that's why some people just attend classes and then straight to work. They're not bothered about these events. As a matter of fact, as far as there's no time attendance, they don't care. What they only care about is attendance marking. So if there's no attendance, none of their business. Not knowing that some of these events, conferences, there are reasons why they're happening for you to actually learn a lot. Outside those four walls of your classroom, you need to pick up on some of those things. Attend these events, conferences, and things like that. And that's why a lot of people miss out on what they need to learn. By the time they are done, you don't have those things again. Because even while being as a student, you get discounts on attending some of these conferences. You get discounts on train journeys, on traveling, on a lot of these things that you don't get the moment your ID card expires, and then you're lost and you're like, what next? It's too expensive for me to go for. I can't pay for this course anymore. I can't do that. But you had those luxury when you were a student to pay for those courses or get them for free through your school or attend those conferences. That would have actually helped you. You didn't do that. So that's one thing people really need to learn and pick out from. Take advantage of being a student. Don't just attend classes. Make sure you go through the school itself, not just go to your classroom. So thank you very much for picking that out. Yeah. My next question would be in terms of some certain skills. So I've realized that you've been integrating a lot of data skills into your role. And lately, there's been a lot of data skills needed in public health. How much of these skills do you need in public health, and how important are they?
So you need to at least know the basics. It was a rude awakening for me, considering that I do not have any data analysis skill background. So I had to do the work, and sadly you have to do too. But then I would also say it depends on what aspect of public health you are trying to get into. But even with that, you still need to know the basics, because everything is also advancing. And you're going to be writing reports. You're going to at least do needs assessments, regardless of where you're going to be. You're going to want to understand the population. You're going to need to do those analyses. And so I had to learn it. I think there's also a difference between doing the MSc and also doing the MPH part of public health. I don't think we also get to really discuss the differences between those two, but it is also essential because I know my best friend just studied the MSc and they did a lot of analysis, and so she had a good background for that. But the MPH is more, theoretical in a way. But we still do have the the epidemiology side of things. I feel like every public health program definitely has epidemiology, and you start with your SPSS, and it's also essential. You need to know that. So my advice for you is go and become the best friend of your epidemiology lecturer. At least learn how to do that one because it's free. Like, you don't need to, because if you can get a good understanding of it, then it's easier for you to now use the software to navigate. I also did this thing where I would get people's portfolios, like their data portfolios that you can use to learn, and some of them are free. It's on LinkedIn. People share it on LinkedIn and they're like, oh, if you want to learn more about epidemiology or how to analyze data, here's a few data sets for you to use to learn. Download it, try it. I did a bit of R and I'm still doing a course on that on Coursera. I'm not doing it, but I now understand it and I'm learning it and I'm using it. I did Power BI as well, Excel, and I'm good at those. So it's also up to you to keep reinventing yourself. No one is going to do that for you. At the end of the day, you are what you put yourself through. And that's the truth. Do you want to evolve the way everyone else is evolving, or do you want to remain the same? It's also up to you. And I have to evolve because I need to survive. That is basic human evolution at the end of the day. So you have to do it. And that's why you can also learn in school. Tell your lecturer, you think this is something you also want to be interested in. The resources are going to be free for you at that point. Tell them, do you think you need this? Because if you do this, it makes you, it gives you an edge. Like, speak to your lecturers, guys. Tell them what you want to do. That's why they are there. I think each school, I don't know about other universities, but we had our own, lecturer that was attached to us. So if we wanted something or we needed help with something, we could always go to them. They are not there to just be there. They are actually there to help you become a better student. And so go to them and explain what your goals are. That would be don't be afraid. I know the culture of I know I didn't study in Nigeria and in terms of university, but I do understand how it is because I've heard stories and my friends have also studied. So I understand how there is that fear instilled as a student and not being able to approach your lecturer. But it is a different ball game in this country. You are paying that school fees. Yeah. You're not going to that university for free. You're actually paying to ensure you get all the resources that you can. That is why they are there. And they take pride in ensuring that when you graduate, you are a well-rounded student. That is what universities here take pride in. So if you think something can benefit you, go and ask your lecturer, say, this is kind of my goal, and I don't know how I can best navigate this. I think I need this software. I think I need to learn this. They can help you and guide you. They've been where you were before, and what they want to do is help. So, in my opinion, go as a student, because I should have done that actually, and I didn't. Well, I did at a point because my lecturer did help me understand SPSS much better because I didn't really understand it. But in terms of what I could have achieved way more, and I had to learn all of this outside university with my own money, and you could have done it for free. So learn from me. Thank you.
All right.
So
thank you very much.
So the question is it essential? Yes, it's essential. It's something that you should be willing to learn.
Thank you very much. Normally, I would have just gone to the last part of the question to say what advice you have for people currently studying now and all of that. But this episode has been full of advice from the very beginning to you now, so there's no need to go for that. Anybody that has listened to the episode up until this moment has definitely picked up a lot of things that can actually help you out. So thank you very much for this episode. It's been really expansive and great. And I'm just going to reiterate on some of the things you've said. The first thing is mindset shift. You need to have a mindset shift. When you're coming to this country, you need to make up your mind on what you want to achieve. You're not just coming here to survive. You're coming here to actually set up something for yourself, build the next level of your life. So don't just come and take up whatever is given to you or whatever you see on ground. You need to try and build up those opportunities yourself. And that same mindset shift goes into what you just mentioned now about lecturers. You've come from a climate where you've been made to fear your lecturers, be scared of them, don't go near them. But this is a whole different ball game. They are there for you now. Aside your lecturer, they are career hubs, they are career mentors that the schools have positioned for you that you can walk into, and they would actually help you out. So as you're coming here, you need to do a wipe of the memory you've had. You need to do a wipe of the mindset you've had from where you're coming from to say, take whatever you're given to, accept it like that, don't speak. But you're aware where you can actually determine the next years of your life, where the next years of your life is actually in your hands. You can decide what you want and you can work towards achieving that goal. And that's what Brenda has been speaking of from this episode started. Picking up volunteering roles, moving around, speaking to lecturers, picking up new skills, learning new courses, and doing all these things because she had set a goal for herself and she wanted to achieve it. A lot of people come in and really do not have goals. They just want to know that after my studies, I want to be able to stay. But aside that, what actual goals do you have for your career? How do you want your career to go? It's all in your hands and it would shape out how you decide to mold it. So please, let's pick out some of all the examples Brenda has given this episode and begin to build on it. If you're still in school now, lucky you. Pick up some of these things, speak up to your lecturers and take advantage of that current status, because once you're no longer a student, you lose some of these things. And if you're no longer a student, it's not too late. You can still speak to people, network, go to LinkedIn. There are a lot of people that are ready to give you free help, give you free resources on LinkedIn. She mentioned Twitter, on social media spaces. They're not just for chit-chatting. You can actually meet great people on some of those platforms. So it's never too late for you. You can start today and start building up those skills, and it can determine how the next years of your career would be. So if you've learned something from this episode, please don't forget to like, share, and subscribe. It will help more people discover this episode and also learn from it. Thank you very much. Keep listening and keep sharing. See you in the next episode.
One last advice before we go.
Okay. Thank you. Please bring it on.
You're not an island. You need friends. You need community. Half of the things that I have achieved right now, yes, I give glory to God for that. But you need friends and community. So, and you can find them in your class. You can find them in your religious spaces. I'm a Christian, so church. You need those help. So I know there's a loneliness epidemic when you come and you think you can integrate, but you can actually make friends because they make life so much easier. My friends helped me analyze my assessments before I even submitted it, and I did same for them as well. So have friends in your class and also outside. Yeah, that's my last advice.
Thank you very much. No,
Yeah.
if we give Brenda the opportunity, she could give dishing out advice for the rest of the day. So we're definitely going to drop our LinkedIn on this episode. You can reach out to her personally if you want more advice and if you want more things she can help you with. So thank you very much. And please don't forget to like, share, and subscribe. See you guys in the next episode. Bye.